before I get started, we're going to play a really quick game. It's called the label game. I want you to look at the person sitting next to you and find a label on them. It could be on a piece of clothing, their purse, anywhere. Really get in there and look at each other and find that label. Great. So I'm glad that was so successful. So normally, I would have everyone start shouting out the labels, but I hear this is a very lively audience, so we're going to skip that part and go straight to what does it feel like to have had somebody look into your space to find that label? So did it feel a little invasive, somebody get into your personal space? A little uncomfortable? Now, what if your neighbor gave you a label and that label could kill you? Would you want to keep playing the game? That's exactly what happened to my brother, Jeffrey. So he was given the label of schizophrenia that put him on the path that actually led to his death. If you met him, he was this avid skateboarder. He was a class clown. He was very outgoing. He could actually listen to a piece of music on the radio and play it exactly on the piano, the clarinet, and the guitar. He was also the type of person that when he left his family, he would only leave after an I love you and a hug. Schizophrenia took everything away from my brother, and ultimately everything away from us, his family. The toll that mental illness takes on a family is often very overlooked, and yet there's approximately 8.4 million caregivers to those who have a serious mental illness. And we tend to caregive actually twice as long as any other chronic health condition. AARP listed caregivers of individuals with a mental illness as the most invisible caregiver. Caregivers also report high rates of financial distress, emotional trauma, depression. They also feel very isolated and alone. They tend not to tell their friends, their family, their churches, their other support networks about their adult son or daughter who is dealing with a serious mental illness. So stigma is kind of one of those words that we see almost as a fluff word or not a big deal or just get over it. And yet stigma is the reason why there's a 10-year gap between the onset of symptoms and actually seeking out any form of treatment. And this is an old newspaper clipping, and I can give you some current ones, but this really kind of points to some of the issues around stigma. This was a fire that occurred at a mental health hospital, and the headline the next day was, "Stigma is also one of the reasons why we have such a high rate of suicide in this country." In fact, CNN reported that we are at a 30-year high for suicidality. So one of the things that people always ask me is, Shannon, isn't stigma getting better? Things are improving. There's commercials out there on depression and anxiety and treatment. And in fact, there was a research study that was done that showed the exact opposite. So if you were asked today if you believe that mental illness is a true disorder or a sign of personal weakness, that value actually went up, which was great. But if you were asked if you were okay with your child marrying somebody with a mental illness, if your coworker could have a mental illness, if your neighbor could have a mental illness, all those values actually went down. So in a sense, what we're saying is, I believe that mental illness is a true disorder and not a sign of personal weakness. You did not bring this on yourself, and yet you must maintain a 100-foot radius from me at all times. It sounds a lot like leprosy. And in fact, I had a person with a mental illness come up to me once and say, Shannon, it is more dignified to take your own life than to admit you have a mental illness. And here in San Diego, an 18-year-old did just that. He took his life when his bipolar disorder was morphing into the more stigmatized version of schizophrenia. So if stigma wasn't enough to make you not want to seek out treatment, then knowing that the premature death rate for individuals with a serious mental illness would. On average, people with serious mental illness die 25 years younger than the general population, or the average age of 52. A lot of the drugs, while they're important and medicine is an important piece of mental health recovery, have led to metabolic syndrome, which has also led to a 2 to 3-fold increase in cardiovascular disease, hypertension, diabetes. There was this amazing doctor at Patton State Hospital who once said to a group of providers, I want you to take 100 milligrams of Benadryl before you go to bed tonight and see what time you wake up in the morning. And the reason he said that was because a lot of these medicines cause you to sleep like cats, about 16 hours a day. So if you don't take your drugs, you're considered non-compliant. But if you do take your medicine, you're considered lazy. So either way, you really cannot win. This is a perfect example of somebody who had a serious mental illness who was put on psychotropic drugs, who gained about a little over 100 pounds. This is John. Julie, his wife, who's in the next picture, was a staff member of mine. John had gained about 100 and so pounds. He was put on oxygen. He had been placed on 16 different meds. And just a year ago, he was told by his doctor that he had less than 12 months to live if something didn't change. So he opted for gastric bypass surgery, so this is the after the surgery, in order to elongate his life. But the problem is, should people be forced to opt for very serious surgeries in order to have the lifespan that we all enjoy? So we need to really connect the mind and the body. So my brother, Jeffrey, if he was here in the audience today, he might laugh out loud, even though nothing was funny. And it might make some of us a little bit uncomfortable. But what we should really be doing is asking him, was that kind of behavior disturbing to him to live the life that he wanted to live, versus just assuming that we should push things on him that he needed? My brother got to the point after he lost all of his friends due to mental illness that he would come up to you and say, "Hi, my name is Jeffrey, I have schizophrenia." And I asked him one day, "Why are you telling people this? They don't need to know, it's none of their business." And he said to me he wanted them to leave him before he started to care about them. So he was isolated and alone, not due to the behaviors of schizophrenia, but the label itself, which is interesting because what Daniel had mentioned previously was that isolation is as bad for you as smoking a pack of cigarettes a day. And also in the state of California, 70% of all cigarettes that are sold are to those who have a serious mental illness. So, we know that the mental health system in the United States has failed, and failure in and of itself is really not the problem, but doing something over and over again and expecting a different outcome is. So we need to change the system, connect the brain and the body. We also have an issue where people are in this revolving door mechanism with hospitals. So hospitals are an integral part of the mental health system, but every time somebody goes in, they feel like a failure. Sometimes they come out feeling traumatized. What we want is hospitals to be seen as a place of healing that people go to voluntarily. But generally what happens and how you enter the mental health field is that your parent calls the police. The police come out, they handcuff you, put you in the back of a cop car, and take you to a four-walled grade institution. Now let me ask you, if a police officer came in here today and handcuffed you and placed you in the back of a cop car, do you think that they're taking you to a place of healing? No, and neither do our patients nor our families. So we're setting up the system of this place of distrust. And what we really need to do is build back these bonds of trust between the patient, the provider, and the family. So 1 in 5 individuals have a serious mental illness, and 1 in 4 family members are caregivers to somebody with a mental illness. So there is plenty of us. You are not alone, and it is okay to be a work in progress. In fact, all of us are a work in progress. What we need to do, though, is utilize our peer voices, so those of us who have been there, done that, to help guide another person on their journey to mental wellness. In this caregivers report, the family members were asked, what do they really need? The 2 top things were help in navigating this convoluted system, and also they didn't want to be alone anymore. They wanted to be with somebody else to assist them on this path. There's this great psychologist out in Boston. His name is Dr. Bill Anthony, and he compared MS to mental illness, and he had MS. And in this article he wrote, he said that in the MS community, you trust your doctors, you trust your pharmaceuticals, you trust your support system. But in the mental health community, we start from this place of distrust. We distrust our doctors, our medicines, and a lot of times, even sometimes our family members, due to them calling the police on us. So we need to really build these bonds of trust back up in order to have an outcome of support, recovery. And then we also need to track this data, use the data from the peer and family support specialist to be used in conjunction with therapy. We need to go from mental illness to mental wellness. And you know how you do that? You replace I with we. So I am a sister of somebody with a serious mental illness, and those of you who are siblings know what it's like to be very alone in this journey. With 80% of American households having more than 1 child, and then 1 in 4 families having a mental illness, they're caring for somebody with a mental illness, there's a lot of us siblings out there that are very alone. We've had grief, we've had anger, a lot of different feelings of needing support. And I'm very interested in talking to all the siblings out there and how we can bring this network of other siblings families together. I've had too many times where I've had a sister fall apart in my arms because they have waited 20 years out of anger and grief, not wanting to be with their brother or sister with a serious illness, have lost holidays, have lost the aunt or uncle for their children. So we need to kind of work on bringing these families together. So my brother spent the last 4 months of his life in a mental health hospital because there was no other place for him to go. And on the last night of his life, my mother was visiting him to celebrate her birthday. And he wanted to go on a cigarette break, but it was 2 minutes before the break. And so he was getting a little agitated, and they decided to give him an Ativan, and then another Ativan, on top of all the other drugs that he already had in his system. Then they asked my mother to leave, and they told her that they would be caring for him. And what they did was put him into a 5-point prone restraint in a 4-walled grade room by himself. Within minutes, my 25-year-old brother had died of a heart attack. And then after we buried my brother, a man came up to my dad and said, "Well, you had to deal with him for so long. Aren't you glad it's over?" So stigma caused my brother to lose all of his friends, being seen as less than human due to having schizophrenia. And he lost his life because of stigma leading to the lack of healing. So I'd ask everyone to just look at your own self-stigma. It's kind of normal. That you utilize peers and family members in your journey to help others reform the mental health system throughout the United States. It is my hope that all the Johns and Jeffs in your life have a chance for recovery, and that we take off the labels that kill people. Thank you.
What I love about Shannon is she really tells it like it is and has been sharing with many people her story and her family story, and you're meeting sort of the unmet need you had as a sibling of someone with mental illness. You know, we have a lot of technologists here, a lot of folks crossing the payer world, the farmer world. What wish would you have for the exponential medicine community to start addressing mental health in new ways?
Talk to us. We are the evidence-based medicine. Those of us that are family members of somebody with a serious mental illness or live with one ourselves, and they're all around you. It does take a little prodding to bring it out, but talk to us. Let us help you in all the work that you do in order to bring the best outcome to our mental health clients.
So not just patients included, family members included.
Definitely family members, please.
Thanks, Jen.
Thank you.